at the end of the day, what you're able to do and why you're on Mission Accepted is just like you showed who you are. Mission Accepted Season 2, Episode 10. How are you doing today?
Hi, I'm doing good, Dr. Gray. How are you?
I'm doing excellent. I'm excited to jump in to your application, share your successes. At the time of your applying to be on the show, 6 interviews, 3 acceptances. Where do those numbers stand now?
So I have been fortunate enough to get 8 interview invites. I declined one invite because I just knew that that spot wasn't meant for me. And currently I've done 7 interviews. I have 4 acceptances, 2 wait lists, and I'm waiting to hear back from the last interview I did about 2 weeks ago.
Nice. What are those 2 wait lists? What are they doing? Come on, get with the program, people.
It's interesting because they're both from the same state. So I don't know, maybe I'm not meant to go to that state.
Yeah, or maybe you never know, depending, right? If you go on Student Doctor Network and you see those school-related threads, sometimes schools will waitlist everyone. I know one school specifically that just waitlists everyone, and they make their final decision much later in the cycle, which is annoying as an applicant. Like, just tell me already, especially if it's a top choice school. But so 7 interviews, 4 acceptances, still waiting to hear back from one. That is phenomenal. That's phenomenal.
Thank you.
What do you think led to your success this application cycle? And just for clarification, first application cycle?
Yes.
All right, one and done, which we love,
Yes.
What do you think led to so much success there?
So this is such a loaded question because there's a lot that goes into, I guess, applying to medical school. It's almost like a year-long process. But I think what led to my success was being very prepared and very organized with everything that was going to go on. I read your personal statement book. So I started writing my personal statement in January. I read your guide to the application book, and that has helped with everything. So following along with all of the advice in those books tremendously helped. Applying early, telling my story and making my application interesting to read. And then also in interviews, trying not to sound robotic and just having a conversation. I think these are the things that led to my success thus far.
Yeah, that's awesome. And we had talked before we hit record about potentially getting into a touchy subject. Mm-hmm. People watching this on video right now will look at you and make some assumptions. We can't always make assumptions, but they'll look at you and go, well, you're an underrepresented in medicine or underrepresented minority, depending on what you want to call it, a URM. Mm-hmm. And they go, well, that's why you got into medical school. How do you deal with that kind of mentality that students are out there? And how much of that do you think played into so much success?
So the first thing I would say to those people is if all it took to get into medical school was being Black, we would have way more than 6% of medical school students being Black.
Amen.
So I'm South American and Caribbean. And of course, I think also 6% for Hispanic students. So I don't know how to combine those statistics to represent myself. Yeah. But I do think that being underrepresented, if I can use this analogy, makes admissions committees take a second look at my application or just look longer at my application, because we do need to have diversity in healthcare. And that is something we're struggling with right now. But that does not by any means mean I got into medical school because of my ethnicity, my race, the color of my skin, so on and so forth. I got into medical school because I really worked my keister off, and I have, on top of my race and my ethnicity, my statistics and my story and my extracurriculars and the way that I interview as well to positively influence my admissions decisions.
Love it. Love it. Great discussion around that. So thank you for allowing us to add that and talk about that. So let's go ahead and jump into your application and see why you were so successful. We take a look at your application here. The first thing I love to point out is always when you applied, and you were slacking. You applied 2 days after the application opened. But it sounds like, again, you started your personal statement in January, so you were working and getting stuff done very early on. And it was processed on the 11th of June, which is awesome. So no issues with applying late. So that's great. We get to demographic information, and we go through. We don't see a disadvantaged explanation, so you didn't mark yourself as disadvantaged. You have lots of siblings. They're redacted out here, but we can see how many lines there are. So come from a big family, which is awesome. No big red flags, institutional actions, felonies, misdemeanors. That always helps. And then we get to grades. And so we start off, and I see lots and lots and lots and lots and lots and lots of A's. 4.0 science GPA, 396 cumulative GPA. Stats, phenomenal, GPA-wise. Then we go, okay, let's take a look at this MCAT score. Oh, you crushed it, 512. Talk about the success MCAT-wise and GPA-wise. What do you think led to that success, other than you mentioned working your keister off earlier?
So I was very fortunate, or very focused during during undergrad. I was very, very focused. I knew that I wanted to get into the athletic training program, which is a bachelor's degree at UCF. And to get into that program, you have to be a competitive applicant. So from the very get-go, I was knowing that I wanted to get into a program that required my utmost focus. And so far as the MCAT, I studied, I reviewed my questions. I was very just focused. Again, I knew that I wanted to get a top score, and I did the work to make sure that that was my reality.
Nice. So you went in with a plan, you executed on that plan, and you knocked it out of the park. So amazing. Congratulations. So again, from a stats perspective, not many doors are being closed on you from a stats perspective. The door may have been opened a little bit wider because of the URM status, but it was already open because of your stats. So that's great.
Yeah,
that's
I like
awesome.
that analogy.
Yeah. So we get to activity descriptions, and it's like, okay, let's see what we got going on here. So we get to the first one here, hobbies, hot yoga. Great. I love hobbies on an application. So hot yoga, and I love the goal with hot yoga is to simply stay in the room. Like, don't give up. So that's great. You have leadership here, student aid committee overseeing athletic trainer. You put 0 hours here. What was the thought process behind what seemed like a very long experience for only putting 0 hours there?
Mm-hmm. So with the athletic training program at Lake Brantley High School, which is where I'm an athletic trainer, we have student aides who pretty much are there every single day that we are there. And further down in my application, I put my employed clinical experience, employed or paid clinical, whatever the title is. And those amount of hours would have exactly been the amount of hours that I'm already at my job. So I didn't want any admissions committee to do the math and then say, oh, what the heck is going on? This is crazy. Okay.
That makes sense. So it's more of a double dipping issue, and you're like, it's just easier to put 0 than to try to figure out, well, 83% of my time was this and 17% was that. And okay, that makes sense. Okay, awesome. Great stories here, right? You got One Day Joe, working with Lynn. You put it in quotes, so I know these aren't real names, so just very clear from the get-go. Very good storytelling to help me understand your interaction, your impact, and everything going on. So really good job there.
Thank you.
We do have this paid licensed athletic trainer here and working at the high school, and you have this very, very, very empathetic statement that I highlighted here. As I am not a parent myself, I can only imagine how terrifying it must be when your child gets injured. Right? That is a very empathetic statement. Like, I can't imagine, or I can only imagine. That to me, as maybe innocuous of a statement that you thought it was, like, to me, that shows you have some good empathy. And guess what good physicians should have? Lots of good empathy. Now, I don't want everyone to go out and force this type of writing and statement into their activity descriptions or their personal statements, but the fact that it was there, like, that's awesome. Do you know if you put that there purposefully? It's just the way that you were thinking about it? Why is that there?
I put that there because in the books, you talk about I guess, showing and not telling.
Yeah.
And rather than saying, as an athletic trainer, you have to have empathy, as a healthcare provider in general, you have to have empathy, I thought about a situation specifically, and there's plenty of situations like this specifically, where parents just flip out immediately. Oh my goodness, does my kid have a concussion? Is my kid's ankle broken? Just they're freaking out. And whenever that happens, I'm like, oh my gosh, I don't have a kid myself, but I can see what they're going through. And I mean, I'm hurting, and I'm just the one, making sure they're calm and that they know what to do next with this injury. So I just wanted to show how I felt and put that into writing without saying I'm empathetic.
Perfect. Beautiful. All right. We have conferences attended. We have research, and I highlighted and wrote here interesting research, because I think a lot of people will think about research and they'll think about like bench research, and I'm in a lab using the micropipette and doing boring stuff and spinning stuff in a centrifuge and waiting for PCR, whatever, right? And you're here going, okay, I conducted a survey that assessed general knowledge of athletic trainers that do contract work and blah, 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 blah. Right? That's research. You have this question. You're trying to answer this question. You develop a survey with questions to help get information, data to help answer this question. Like, that is research. And that's awesome. So we continue on, president of the Honor Society. So some good leadership there. You have who we play for intern, and you talk about the sudden cardiac death and electrical abnormalities of the heart and doing screenings. Potential missed opportunity for a story here. I mention it almost in every video. Like, not every activity description has to have an amazing story that goes with it. Sometimes you don't. It potentially would have been cool to see if you don't have a patient interaction story. Like, how many screenings did you accomplish? How many of those potentially were abnormal and you maybe prevented one of these sudden cardiac deaths? So that would have been potentially interesting to show impact through numbers. But really interesting activity there. And then we get to physician shadowing and clinical observation. It was from a long time ago, October 2018, and it was a 3-day orthopedic experience. Good activity description there. And we have more shadowing, clinical observation through your athletic training kind of program. And so you have lots more experiences there throughout the years. And so you have an interesting, most meaningful experience here that, to me, you're trying to make the pitch already of like, I'm an athletic trainer, but I want to be a doctor. And I'm wondering why you potentially were trying to make that connection so early on instead of waiting for the personal statement.
So I really wanted anyone reading my application to know that I do have appreciation. I do have respect for being an athletic trainer. However, I know that I want to go farther beyond that. And I do think reading back some of my secondaries or some of my, I guess, some of the portions of my writings throughout the whole entire application cycle, I think I was trying to sell it a little bit too hard, but I just really wanted to make sure that it wasn't lost on the person reading my application that she means business. She wants to go to medical school. This is just the current step in her process of doing so.
Yeah. Okay. Makes sense. And we'll talk about that a little bit more in a minute. Extracurricular activity, biology book club, which is great. Talking about a specific book, which is awesome. I took a look at it, added it to my Audible wish list because it looks really interesting. Mm-hmm. I take way too long of showers. I need to take shorter showers. You have travel studies, women in sustainable science. Again, another 0-hour one, which is fine. And then I really liked the story, the activity description that went with this one, as well as the next one here, this other extracurricular activity about being a bunch of misfits and everything else. Really fun, shows your personality coming through, which is really great. I love those. And then we get into a body care team member and janitor at Whole Foods. I love that you put these in your application because a lot of students will be like, what does being a janitor have to do with going to medical school? But at the end of the day, you put this as a most meaningful experience. And I really loved what you wrote about it because it shows who you are at the end of the day. It doesn't try to overly like, hey, like being a janitor helped me become a better physician because of X, Y, or Z. It's like, no, it's like, here's my job. Here's what I love doing. Here's who I loved interacting with. That's it. Like, that's just a part of my journey, a part of my life. Did you have any concerns or questions or doubts about putting this stuff in your application?
Not at all. I actually, of course, my entire application cycle has been fueled by your advice, just admittedly. So I knew that every single part of my application didn't necessarily have to be related to medicine in some way, but it did have to be related to me in some way. And as a person applying to medical school, you should talk about the things that you've gone through. So I really have so much respect for being a janitor, for all the janitors out there. I'm not going to lie and say it was the most glamorous job of all time because it wasn't, but it was a job that taught me a lot about myself so far as making the switch from a job that I really liked to this janitor job because it was the most financially reasonable and responsible thing to do. Before this job, I worked at an indoor trampoline arena. And I think that it was responsible to, make this switch. I needed to buy a car. I had to just put money in savings. And this is what I had to do. Being in that position, I was the only one there cleaning. So I had to rely on myself and really just as an 18-year-old step up to what a lot of 18-year-olds probably might not want to do. Yeah. And I wanted to talk about that during the application and even the interviews. I've gotten some interview questions about that too, which is really fun to answer.
Yeah, it's phenomenal. I think too many students look at the application and they think every spot in the application is, I need to prove I want to be a doctor. I need to prove I'm ready to be a doctor. I need to prove that I have the skills to be a doctor. I need to prove that I know how to be a doctor. I need to prove that I know everything about medicine already. And at the end of the day, what you're able to do and why you're on Mission Accepted is just like, you showed who you are. And this was something that you did because it's what you needed to do as a young 18-year-old needing a car and needing to pay bills or whatever else. It's like, hey, like, it's not glamorous. It's not related to medicine. It's just something I need to do. And I'm going to talk about it in my application because it's a part of my story. It's part of my journey. And it's reflected through conversations that you have in your interviews because the interviewers are like, hey, thank you for showing that you're a human being. Let's talk about this experience. It looks very interesting. Mm-hmm. That's all. Yeah. That's all the application is. So many people overcomplicate it. Like, I have to prove that being an environmental engineer at Whole Foods led to these skills that I'm going to then take and become a better physician. I'm like, no, that's not the goal. That's not the point here. And I really like the name environmental engineer, which is...
They called us the green team, but we knew what it was. We were janitors, which is no slight. Like, I'm not better than any job. I have no ashamed feelings that I was a janitor. Yeah. In fact, if anything, I'm really proud of myself.
And honestly, because you were in that position, because you had that job, you will be a just beloved member of the healthcare team with everyone in the hospital. Because you're going to say hi to all of the janitors. You're going to know their names. You're going to help out if you end up in a surgical field. You're going to be in there like I've seen many surgeons do. Instead of as soon as the case being over, you leave, you're going to be in there helping turn over the room so you can start the next case. And a lot of people are like, well, why is the attending surgeon like taking out the trash? I'm like, because it needs to be done, right? Yes, exactly. Nothing is beneath anyone if you're that type of person. And because you've had those experiences, that's probably who you're going to be in the future, which is phenomenal. I wish everyone was like that. All right. So then we get to the personal statement. But before we get to the personal statement, here's my concern that I have, and ultimately why I asked that question about you kind of overselling this athletic trainer to physician position. is because you lack traditional clinical experience.
Mhm.
Did that come up at all?
Yes, so it did come up in my last interview where the person asked, "Do you have any other experience besides this?" And I said, "Admittedly, no, I don't." And that's something that I think should be bolstered in my application, and I, accept fault for that.
Yeah.
Um, Athletic trainers are required to shadow. I mean, they're required to work with with physicians. Sorry, so we always have to have physician oversight so far as having standing orders. And Friday Night Lights, there's a physician on the sidelines. Whenever I refer to a specific physician. So I have a close working relationship, but you are correct that I don't have that traditional in the hospital or outpatient setting where I'm directly looking at a physician do their thing.
Do you think that hurt you when it came to trying to formulate why you wanted to be a physician because you lacked the traditional patient exposure?
Mm. Honestly, I'd probably say it hurt more than helped, if anything. I'd like to say it was neutral and didn't cause any effect one way or the other. But again, in my personal statement, I remember writing about seeing the physicians in the athletic training facility do their thing and trying to speak on that and say how I knew that athletic training wasn't my last step. And because of watching a physician do their thing, I knew that's what I wanted my next step to be. But yeah, I think that I could have done a better job in that regard and getting traditional shadowing.
Was that something, looking back on it potentially is clear. And it's like, oh, yeah, that was kind of silly. Maybe I should have. Ultimately, it obviously didn't hurt you enough to not get multiple acceptances, but maybe it could have opened the door to more. And maybe those two wait lists, they're hesitant because you don't have traditional experience. So we can always kind of Monday morning quarterback it. Do you think at the time as you're going through this process, were you aware that it was a potential issue and you just didn't have time? Or did you just think, oh, athletic training, I'm taking care of patients, I'm taping ankles and evaluating for injuries, and that's clinical experience, so that's good enough?
I definitely was a little bit worried, not worried to the point where I was thinking, oh, I should push back my application cycle until next year, but definitely worried so far as, hey, if someone asks you this during an interview, you better have a really good answer provided and still show that you mean business. So I was mildly worried, yes.
Okay, interesting. Awesome. Good discussion there. And something I think a lot of people in very similar situations will hopefully take something away from that. So we start with the personal statement and we have a really good hook. The one thing potentially that would make it even better is there's lots of she's here. She was sitting on the cold. She was doing this. Her face was this. She. And I put a comment. I'm like, give her a name. Now, it's interesting. Yeah. You gave her a name later, but I would have loved to know her name earlier on. And that's just a personal thing for me of like, I like names. It helps me kind of remember and picture someone better than she and her. But you did have the name there ultimately, which is great. And the seed, right? I talk about the seed all the time. I talk about it in my personal statement that the seed is exposure for healthcare, not necessarily for, oh, I want to be a physician. And your seed is towards athletic training, right? Which makes sense based on the story that you've already told through your activities and everything that you put there. There's one part here. So you have this seed, and then all of a sudden you talk about here you were accepted into the athletic training program at UCF, and several years you had to think about blah blah blah. And it seemed like, and again, I think this is part of the struggle that you had with the storytelling of how do I paint this picture of athletic training to medicine. You basically just squished it all together and said, I had several years to think about it. I want to be a doctor, right? And so there was a big part missing. And so that's probably the weakest part of your story is how did one lead to the other, which we've already talked about. Your conclusion here for this paragraph, you talk about, I wanted to know more about the patient's condition and be at the forefront of the care being provided to them post heart attack. And I wrote this very common question that I ask here is why? Why is that? lots of students will leave it as the what, but not the why. So it makes it a much stronger conclusion, much stronger reflection to include that why there as well.
Mm-hmm.
Your next paragraph, again, decision for career change, also guided by facts. You're required to work with the doctors. So again, I think your personal statement overall told the story, but the distraction for you was I really, 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 really need to oversell this. I know I want to be a doctor, because your experiences didn't support that. So I think you understood that as a weakness, and you wrote about it in your personal statement, which makes your personal statement a little non-traditional because you're trying to overcompensate a little bit, if that makes sense.
Yeah, it does.
And then you have here, athletic training does not require the same depth of education that I personally want. Our scope of practice tends to be broad and without specialization. So I typically recommend focusing as much as possible on the patient. Like, what is your training going to do to help the patient? And how you write is very common for students to write is it's all focused on me. Like, I want the power, I want the knowledge, I want this, I want that. And so just flipping it just a little bit of like, and this will allow me to do whatever, right? And it's very interesting. Again, your weakness, which again, ultimately was not your kryptonite because you have been very successful through the application cycle, is this lack of traditional clinical experience to paint these pictures of oh, I see why you want to be a doctor. You have this in your conclusion. In so many words, he told me, you cannot let your fear of something that has not happened yet control your career decisions. Basically, you had this internal dialogue of like, I'm going to be responsible for patients. I don't know if I can handle it. I'm scared of that. And somebody said to you, don't be scared, go and do it. And you're like, well, okay, I guess I'll be a doctor. And so it's interesting because that one line, it seems a little silly, but to me it's pretty powerful because it tells me there's a much bigger internal dialogue of you wanting to be a physician that didn't come out in this story at all.
Okay.
So to me, there's some missing reflection that you've either suppressed because you're like, I'm not good enough, I'm too scared, whatever, that you've had this desire to be a physician a lot longer than maybe you're letting on to, of like, well, I've always wanted to be an athletic trainer. And through the times I realized and shadowing the orthopods and seeing what they do and realizing I'm lacking the ability to do a little bit more. To me, it's much deeper than that, and you've had these feelings for a little bit longer than you're letting on to. Would you maybe agree?
I think I wouldn't necessarily agree with the time frame.
Okay.
These things were happening like after I got accepted into college. Or even in high school, I was not that great of a student. And then when I got into college, I got my stuff together. But I used to have death anxiety, and that kind of played a role in being an athletic trainer, that I wouldn't necessarily be in the OR. I wouldn't be in an emergency room department. And in athletic training, you're not really, I guess, going to be exposed to as much possible death. So I kind of felt comfortable there. And I was talking to my mentor, I'll never forget, in the baseball dugout at a baseball game. And he's like, oh, Camila, you could have someone die on you no matter where you're at, even in the grocery store or like a gymnastics event. It could be anywhere.
Yeah.
And
the baseball game, the pitcher gets hit in the head or hit in the chest, their heart stops, or they have a brain bleed, whatever.
Yeah, exactly. And he was being like very, very intense because his not best friend, but his really, really good friend died on a motorcycle right next to him. And he's talking to me about it. And I'm like, oh, wow, it's amazing that you got through that and you're able to share your story without, crying or whatever. And I realized, I really shouldn't be scared. I shouldn't let my death anxiety or let anything that hasn't happened yet dictate whether or not I try my best to make my career goals come true.
Yeah, but see, even that language, your career goals come true.
Mhm.
When did you realize that being a physician was the career goal? Because everything that your personal statement says and all of your activities say your career goal was to be an athletic trainer.
I can't give a specific date, but when I was in the athletic training program, yeah, or like if not then, like directly before the athletic training program, I think I was thinking about becoming a physician and kind of like, oh, don't think about that. Like it's don't.
Yeah.
And then
I think if we had time and we sat down over coffee, like I could figure out that you wanted to be a physician before you wanted to be an athletic trainer. And you realized that athletic training was the safe route. Not necessarily like I can't do medicine because I'm not strong enough athletically, but safe for your anxieties or whatever. I almost guarantee you that medicine is there somewhere, that you've had this dream longer. So it's very interesting, and I'd love to peel that onion some more with you. Obviously, we don't have unlimited time here, but at the end of the day, you were successful. That's all that matters, right? Very successful in terms of the schools that you got into, very strong programs, schools that obviously loved maybe a little bit more of a non-traditional experience in terms of the exposure that you were getting, and ultimately gave a chance on you because of your stats, because of your URM, because whatever. Phenomenal job with your application, telling your story, being true to who you are, and ultimately telling the interviewers what your story is all about.
Thank you.
Talk about your school list, because you have probably one of the few school lists where the majority of your schools are not public out-of-state schools, where your chances are usually much lower. How did you go about finding schools to apply to?
I think this is something I could have been a little bit more prepared with. I was studying for the MCAT while I was just beginning to apply to medical school. So I was kind of thinking, okay, I need to make a school list. And this is something that I probably should have been thinking out like years before it happened. But I wanted to go to school in a city because it was very important for me to live somewhere that had great diversity. And the cities that I applied to had great diversity.
Okay.
I wanted to apply to schools that had good pediatrics involvement, good community service involvement. And these were the schools that kept popping up whenever I would search, I guess, on MSAR or Google, schools that are good for blank, and so on and so forth. And I wanted a large class size too.
Talk about the pediatric aspect, because that hasn't come through in your application at all.
All of my athletic training experience, besides working at UCF, has been with pediatric. I think I could have done a better job at maybe describing that, but I know that I really do want to work with kids. So I want to make sure if I'm able to attend a program that has their own children's hospital or has really good affiliation with a children's hospital, so I can get as much pediatric, I guess, experience. That's really my focus there.
That's interesting, because my assumption would be that you would be interested in something like PM&R, physical medicine, rehabilitation, physiatry, or some sort of maybe like ortho sports med with your athletic training background to potentially stick with that. Obviously in pediatrics, you can do some sports related medicine in pediatrics as well. So that's very interesting.
Yeah.
Talk about the interview side of things. So you put together a great primary application. My assumption is you did just as well secondary wise. What did it look like to prepare for your interviews?
I think I could have done, I didn't read your interview book. I skimmed through it because there was a promotion where you were sending the PDFs to all of your books if you bought one specific one. I'm forgetting what that book was, but I read through it because I had the PDF.
Yeah.
But I've been through so many interviews in my life that I felt confident not necessarily reading that book. And if I could go back and change it, I would have read it, cover to cover. But ever since I was, I think my first job was when I was 16. I was a gymnastics instructor. I had an interview for that as a 16-year-old. I didn't know what the heck I was doing, but I interviewed for the athletic training program. I interviewed for the job I had now. So I felt good in that department. but if I could go back and read your book, I would.
Yeah. Okay. Uh, do you think it's interesting because I often warn people who are coming more from the business world who have had lots of non-medical school interviews, like the medical school interview is different. Did you feel it was different and in how it was executed?
The interview days are different for sure. Interview days are no joke. I had no idea. They're truly like they're 9 to 5, if not longer.
Yeah.
But so far as the questions they're asking, I didn't feel like it was that much different from interviewing with the jobs that I have now, because the jobs that I have now, my interview was pretty much a conversation, which I really do like. I know that some schools do something called a stress interview. I don't think I've had that happen just yet, but if I did, I think I'd be able to sniff it out. And then I guess
it's interesting. I often question the stress interview. I know they're a thing, but I think they're a lot more infrequent than students say they are, because I think unprepared students think every interview is a stress interview. And so it's very interesting it'd be very interesting to do some reconnaissance and find out how many schools actually allow their interviewers to do a stress interview.
Yeah. And if that's the way that it works there, then, that's the way it works over there. But so far I haven't had that. But my interviews so far have been very conversational. And I guess the common questions about why medicine, why this school, tell me a time where you messed up and you had to fix it. Tell me a time where you had a conflict and you had to fix it. And then from that, you speak about your mistake or speak about whatever. And then the person asks you more questions and you have a regular schmegular conversation.
A regular schmegular. I love it. Regular schmegular conversation. Well, on that regular schmegular note, we will end there. Thank you so much for coming on, for sharing your story. And congratulations on all your success now and in the future.
Thank you so much.